This podcast is for educational purposes only and is not medical advice. Always talk with a qualified healthcare provider before starting any new supplement, peptide, or health protocol. Today we are diving into L-carnitine and L-carnitine-related peptides, exploring how they work, why people use them, the differences between oral and injectable forms, and how these compounds support fat loss, energy, performance, and recovery. L-carnitine is not a traditional peptide in the strict biological sense, but many people group it with peptides because it is often used in similar wellness and performance protocols. For clarity, when I refer to L-carnitine peptides, I am referring to the injectable forms frequently marketed or discussed alongside peptide stacks, including L-carnitine, acetyl L-carnitine, and injectable blends designed to enhance fatty acid oxidation and metabolic output. So let's get into what L-carnitine does, how it feels, and what people commonly expect when adding it into their routine. L-carnitine is a naturally occurring compound that your body already produces. Its primary job is simple but powerful. It transports fatty acids into the mitochondria so they can be burned for fuel. Think of it like a shuttle bus. Fat can only be used for energy if it can get inside the mitochondria, and L-carnitine is what drives it there. When your levels are low, you burn less fat, you feel more sluggish, and your workouts feel harder. When your levels are optimized, energy production becomes more efficient. Many people describe it as feeling cleaner, more stable, and less jittery compared to stimulant-based energy boosters. Oral L-carnitine works for some people, but for many, the problem is absorption. Only a small percentage is actually utilized. Injectable L-carnitine bypasses digestion and delivers a much higher usable amount directly into the bloodstream or muscle tissue. Because of this, people often use the injectable form for fat loss support, weight management, physical performance, cognitive support, and recovery after intense training. One of the biggest reasons injectable L-carnitine has exploded in popularity is its effect on stubborn fat. It doesn't burn fat by itself, but it increases the availability of fatty acids to be used for energy. When you combine this with calorie control, activity, or training, many people notice faster results in the areas that normally resist fat loss. Let's talk about how it feels. Many people report a warmth or slight energy increase after injecting L-carnitine, especially if it is administered intramuscularly. It's not a stimulant. It won't give you the jitters, but it can make movement feel easier. Workouts feel more powerful. Endurance lasts longer. And mental focus tends to be clearer, especially with acetyl L-carnitine, which crosses the blood-brain barrier more effectively. People who use L-carnitine regularly often describe a cleaner burn during cardio, a lighter, less sluggish feeling in the legs, and a smoother transition between stored fat and energy use. Now, let's dig into the different forms and what makes each one unique. Standard L-carnitine is typically used for fat loss and physical energy. It boosts fatty acid transport, supports mitochondrial function, and improves endurance. Acetyl L-carnitine is often used for cognitive support, mood enhancement, and neural protection. It is popular for people looking to optimize brain fog, memory, motivation, or mental clarity. Then there are combination blends where L-carnitine is mixed with other metabolic compounds like choline, B vitamins, or lipotropic cofactors. These blends attempt to amplify fat-burning pathways further by pairing carnitine with ingredients that support methylation, liver function, or thermogenesis. Let's shift into how L-carnitine works during exercise. When you perform steady-state cardio, weight training, or high-intensity interval training, your body constantly shifts between burning carbs and burning fat. The more efficiently your body can move fat into the mitochondria, the more stable your energy feels. That is why people who supplement with L-carnitine often report better endurance and less crashing. In strength training, it may slightly increase work capacity, letting you push a bit longer before fatigue kicks in. In recovery, it supports faster clearing of metabolic byproducts that build up in the muscles, reducing soreness for some people. Another major area where L-carnitine shines is in metabolic flexibility. This means your body can switch between carbs and fats more efficiently. When metabolic flexibility improves, cravings become easier to manage, hunger becomes more stable, and your overall energy throughout the day becomes more predictable. For people who follow low-carb or ketogenic lifestyles, L-carnitine can help smooth the transition into fat-burning mode. For people who are active or athletic, it supports better fuel utilization during training. One interesting aspect of L-carnitine is its impact on hormonal profiles related to metabolism. It may support thyroid conversion, helping T4 convert into the more powerful T3 hormone. It may also support androgen receptor density in muscle tissue, allowing your body to use the hormones it already has more efficiently. This is one reason why many bodybuilders or athletes incorporated in cutting cycles, recomp periods, or conditioning phases. Now, let's talk about cognitive benefits. Acetyl L-carnitine in particular has gained a strong reputation for its effects on the brain. Many users describe clearer thinking, faster recall, better mood stability, and improved motivation. It supports mitochondrial function in the brain, helps regulate acetylcholine levels, and may support long-term brain health. It is sometimes used in nootropic stacks, anti-aging protocols, and neurological wellness routines. People with brain fog, burnout, or chronic stress often report meaningful improvements when using the acetyl form consistently. In terms of dosing, people use wide ranges depending on goals and experience. I am not giving medical advice or specific dosage instructions, but generally speaking, injectable L-carnitine is often used anywhere from a small daily dose to larger amounts before training. Some people inject it daily, others only on workout days. Acetyl L-carnitine, in oral form, is commonly used at lower doses than injectable versions because it absorbs more efficiently into the brain. The exact approach varies depending on metabolism, goals, body weight, and tolerance. While L-carnitine is generally considered safe, some people experience mild side effects. These may include digestive discomfort with oral forms, slight soreness with intramuscular injections, or a fishy smell if the gut converts a portion into trimethylamine. Injectable forms bypass digestion, so many people choose them to avoid stomach issues. As always, it is important to speak with a qualified healthcare provider to determine the safest and most effective regimen. Now, let's talk about synergy. L-carnitine pairs well with multiple peptides and supplements. For performance, it is often combined with growth hormone secretagogues, mitochondrial peptides, and compounds that support energy pathways. For fat loss, it is commonly stacked with GLP compounds, lipotropic blends, thyroid support, or thermogenic boosters. For cognition, acetyl L-carnitine is frequently combined with nootropics that affect acetylcholine, dopamine, or mitochondrial function. The idea is that carnitine enhances the transport and utilization of fuel, while the companion compounds enhance signaling, focus, recovery, or thermogenic output. People often ask how long it takes to feel the effects. With injectable L-carnitine, some people feel an energy shift almost immediately, usually within 30 to 60 minutes. Others notice changes after several days of consistent use. Fat loss-related benefits tend to show up gradually over time, especially when combined with nutrition and activity. Strength and recovery benefits often appear within 1 to 2 weeks. Cognitive effects from acetyl L-carnitine can be noticed within hours for some people and within days for others. Another frequent question is whether L-carnitine works without exercise. The answer is that it can still support metabolic efficiency and energy production, but it is dramatically more effective when paired with movement. Because its main job is to shuttle fat into the mitochondria, the more you move, the more fat becomes available as fuel. Even light walking can improve results. For people with mobility limitations, L-carnitine may still offer cognitive benefits and basic mitochondrial support. Let's talk about who tends to benefit the most from regular L-carnitine use. People who train regularly, especially those who do cardio or high-intensity work, often see the greatest difference. People who struggle with stubborn fat areas may notice enhanced results. Individuals with low energy, chronic fatigue, or mitochondrial sluggishness may feel more stable. Those on low-carb or ketogenic diets often find transitions easier. And people with cognitive fog, burnout, or mental fatigue may respond well to acetyl L-carnitine specifically. Another interesting application is in the aging population. As people age, natural L-carnitine levels tend to decline. Mitochondrial output decreases, recovery slows, and fat metabolism becomes less efficient. L-carnitine supplementation may help counteract some of these effects, leading to better energy, mobility, and metabolic efficiency. This is why L-carnitine is sometimes included in anti-aging peptide protocols, metabolic wellness plans, and longevity stacks. Now, let's focus on the practical aspects of using L-carnitine. Timing is important. Many people take L-carnitine before workouts to maximize fat use during training. Others take it in the morning to stabilize energy throughout the day. Some people divide doses to maintain consistent levels. For cognitive benefits, acetyl L-carnitine is often taken earlier in the day to support focus and productivity. The method of use varies, but the key is consistency. Users often report a few unique sensations when L-carnitine begins working. Some feel a gentle body warmth, especially during cardio. Some feel more oxygen flow or easier breathing. Others describe a lighter feeling in the legs, as though fatigue takes longer to appear. Mental clarity can feel subtle at first, then suddenly obvious once you compare how you feel with and without it. One topic that comes up often is whether L-carnitine interacts with caffeine or stimulants. Many people combine them without issue and actually enjoy the clean, amplified energy effect. L-carnitine supports the fuel side of metabolism, while caffeine stimulates the central nervous system. Together, they can create a powerful synergy that boosts endurance, focus, and performance without excessive jitteriness. but this depends on individual tolerance. Another synergy worth mentioning is between L-carnitine and sleep quality. While L-carnitine does not directly induce sleep, improving mitochondrial efficiency can reduce daytime fatigue, which may indirectly improve sleep cycles. Some users report feeling more restored in the mornings after using L-carnitine consistently. Others notice reduced brain fog and better ability to stay awake without crashing. Let's talk about long-term use. Many people wonder if L-carnitine needs to be cycled. Because it is naturally produced by the body and found in foods, many experts consider it safe for long-term use. Some people cycle it only to evaluate how they feel without it, but it does not appear to be one of the compounds that require strict on and off cycles. Injectable forms may be used more cautiously simply due to the method of delivery, but again, this varies based on individual health and guidance from healthcare providers. Now, let's discuss expectations. L-carnitine is not a magic fat loss tool. It won't make fat disappear without movement or nutritional control. But it can make your body significantly more efficient at using the fat you already have as energy. It can make workouts feel better. It can help stabilize mood and mental clarity. It can support recovery, performance, and mitochondrial health. For many people, L-carnitine becomes a foundational part of their wellness or fitness routine. As we wrap up, let's summarize the core benefits. L-carnitine increases fatty acid transport. It boosts mitochondrial energy production. It supports endurance, recovery, and performance. It can help reduce stubborn fat when combined with activity. Acetyl L-carnitine supports mood, focus, and cognitive function. Both forms play roles in metabolic health, anti-aging, and overall vitality. L-carnitine is versatile, well-researched, and accessible, making it a popular addition for people who want more steady energy and better metabolic output. This podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified healthcare provider before starting any new supplement, peptide, or health-related protocol. Thanks for listening, keep learning, and stay curious.